Welcome to the Derm Vet podcast, where pet skin is always in. I'm Dr. Ashley Bourgeois, board-certified veterinary dermatologist, skin nerd, and your go-to guide for everything itchy, smelly, and inflamed. I'm here to take the itch out of your day and make derm more fun than frustrating. Grab your microscope and let's focus in. Welcome to another episode of the Derm Vet podcast. For those of you joining us on YouTube, so you can see the space and then see some really cool clinical images, welcome as well. I know ears, right? Ears can be so difficult. And I know it's something that you guys are commonly dealing with in general practice. Year after year, we see this data come out from insurance claims, and otitis is always like in the top 3 or 4, right? And allergies are usually number 1. So I know in general practice that you guys are dealing with a lot of cases of otitis. I also know how frustrating otitis can be. It can be frustrating to me, and I literally just do skin and ears. There's so many different products or so many different reasons for ear infections, so many different severity of ear infections. So I just wanted to put together, in my experience, the 5 mistakes I see with treating otitis. And, I have made these mistakes before. I get it. This is not meant to be judgmental at all, but just going through how we can improve things, right? Very similar to when I go through a case with a colleague and I'm like, oh, shoot, I didn't do this, or I missed that, or I've learned over the years of practicing. So, top 5 mistakes I see in managing cases of otitis. Number 1, I love talking about cytology. The number 1 mistake I see is not doing ear cytology. And I get it. You guys are busy. You're seeing lots of different types of patients compared to me, who's just seeing skin and ears, and you feel like you have more pressing things that are coming through the door. You're behind on your appointment schedule. Someone called out sick, right? Where no one has excessive time. But it can be really easy to get caught up with ear cytology, not doing it, because a lot of the products traditionally have been combination products, right? So most commercially available products have an antibiotic, an antifungal, and a steroid in them. So it's easy to say, well, I'm going to be using those anyway, so why not just treat that? And a couple of reasons for that. One, we of course want guidance on what topical we're going to put in the ear, right? What I'm going to decide to put in an ear, if it is rods, mostly under the microscope, is different than what I might put under the ears if it's cocci, and definitely different what I'm going to put in the ears if it's just yeast or a combination of those. The other thing is, what do you do when that pet doesn't respond? If they come in for a recheck and the owners say, it's no better, maybe it's worse. You don't know what got better and what didn't, right? So if I started out with a lot of rods under the microscope, they come in, the owner says they're not doing better, but then I sample and it's all yeast, I'm going to put together a much different protocol or plan than if it really was just rods that weren't responding. Also, now we do have products that don't necessarily have everything in them. So sometimes we have compounded certain products that have just been in anti-yeast and a steroid. But now we have, at least in our country, in the United States, but then I know there's some of you practicing in other areas that might not have it, but it could be coming your way. There's a new product out by Decro called Duotic, which is just anti-yeast and steroid. So now we do have an option, and we can see lots of cases that just have Malassezia otitis. And I recently gave a presentation about Malassezia otitis, and I'd actually stumbled across a recent paper out of the University of Tennessee that actually showed some cases of suppurative Malassezia otitis that clinically, like from from the naked eye, actually looked like Pseudomonas. It's kind of more like gooey, biofilmy, like we'd expect from Pseudomonas, but they actually found just Malassezia. So you can't tell without actually sampling what is exactly under the microscope. And now we do have options that don't include antibiotics, which obviously from a judicious use of antimicrobials, we want to be doing. We want to recheck those cytologies, making sure they're clear before we consider stopping therapy. If they're not responding, we need to know what is not responding. So ear cytology is super important and definitely something that you can treat or teach your technicians and assistants to do, empower them, something you can learn to do very quickly on your own if you need to. So ear cytology is very crucial, especially for something that can develop resistance quickly, can be very frustrating for the owner, and something that you guys are seeing a lot of. So we want to get comfortable with it. Number 2 mistake I see as far as managing otitis is not implementing an appropriate ear flushing protocol. And that can either be from product selection or like maintenance long term. So ear flushing is super, super, super important. Uh, with the products, the treatments themselves, it is great that they have a steroid and antimicrobials in them, but we want to remove the debris out of the ear, especially when we're talking about things like Pseudomonas that can develop a lot of biofilm. We need to get the stuff out of the ear. The other thing I think about with ear flushing is maintenance. If we want to try to lessen the recurrence of ear infections, having a good maintenance protocol with a cerumen super beneficial. Also, just giving owners education about how to appropriately flush the ear, what to do if they start to notice the ears flaring. So I have lots of dogs who live on once weekly, maybe every other week maintenance flushing, but they know to increase the frequency if they start to notice their pet bother their ear. I'm all about giving owners that proactive plan of what they can do if a flare starts so that we can get ahead of it and try to, stop it from becoming something they have to see me for. So flushing protocols can be important. We also want to get uncomfortable with the ingredients in flushes and why we're using them, which of course, again, is why cytology is so important, right? Because we want to feel comfortable knowing, is it a bunch of rods and I should pick a product that has tris EDTA or N-acetylcysteine in it or both? Is it a bunch of yeast? This dog struggles with yeast otitis, and implementing some ear flushes with a product that changes the pH of the ear, because we know a lot of the anti-yeast flushes are acidic. Yeast doesn't like to be acidic. So having things like acetic acid, boric acid to decrease that pH can actually be anti-yeast. So that's really helpful as well. So knowing what you're treating to select appropriate ingredients can be really important, but also knowing from a maintenance standpoint how you're going to educate the owner to ear flush, that they can do it appropriately, and then that we do find the protocol that lessens the recurrence of ear infections can be really, really helpful. Number 3 mistake, and this is a big one, and this is not controlling inflammation. So we often focus on the infection, and the infection is super important, but it is crucial that we also control inflammation. If that ear is becoming stenotic, edematous, we want to control inflammation, and there's a couple ways that we can do this. One is through systemic therapy. So if we do have a really stenotic, uncomfortable ear, you'll often see dermatologists reach for oral steroids, even just a short course to open up the ear canal to reduce the inflammation and edema. This in turn often produces a lot of comfort for the animal, which obviously we want. But also, it may guide what topical treatment you're doing. Maybe there is a lot of neutrophilic inflammation under the microscope. Maybe there is a lot, again, of stenosis that I'm seeing when I look in the ear canal with my otoscope. And using a product that has a more potent steroid actually can be really helpful for that ear itself. So making sure we're thoughtful of, again, the ingredients in our products, that we pick a more potent steroid if it's necessary or helpful, if we need to, using an oral steroid to open up that ear. But if we have a really inflamed stenotic ear and we're not controlling that inflammation, we're going to likely struggle to get comfort for that pet and to resolve the infection itself. So that's extremely, extremely important. I would say that is something that I've always done to some degree, but I've definitely even gotten more thoughtful of. Not so much even just in my oral steroid dosing, and I will go higher anti-inflammatory dosing, even if it's just for a few days in those really bad cases. But also the type of steroid that's in the product that I'm selecting topically can be very, very helpful. Okay, mistake number 4 that I see in managing otitis: not rechecking progress. This is super, super important. When we treat an ear issue, especially something that's moderate to severe, maybe if there's just like a couple of yeast under the microscope and you're just going to increase the type of flushing they're doing, it might not be super crucial to get them in 2 to 3 weeks. But those ears that are moderately infected, severely infected, or symptomatically the pet is really bad, right? Like maybe the infection's mild, but symptomatically the pet's really shaking their head and uncomfortable. It is super important to recheck progress. I want to make sure they're more comfortable. I want to make sure that the changes I saw inside the ear are improving, whether that is the stenosis getting better. If they were really ulcerative, then making sure those ulcerations are getting better. If there was a ton of discharge in the ear, making sure the discharge is getting better. So I want to actually look in the ear, talk to the owner, and know things are improving. And I would say usually, depending again on the severity of the infection, recheck them like 2 to 3 weeks in just to see what kind of progress we have made. But this is really crucial because it allows me to pivot my therapy and plan if they're not responding the way that I want them to, instead of risking a lot of those perpetuating factors from happening. Perpetuating factor would be the nasty things with ears, the really bad stenosis, the edema, and then the thing we can't reverse, right? Calcification. So by seeing them more often when they're in an infection, evaluating them, I'm hoping to lessen the chance we end up with those really bad changes. Also, right, there's a lot of faith lost in me if that pet doesn't get better. And if I just send them to the abyss, treat the ear and send them to the abyss and don't have them come back so I can adjust things if needed, then I'm going to probably get a really frustrated owner. And sometimes life's busy. Owners can't necessarily call us just to tell us things aren't going well, right? They might just get frustrated and go somewhere else or look for other sources of information. So the recheck allows me to adjust things if I can, to really pivot if things aren't responding the way I want to at all. And it's really, really important. So rechecking these ears, making sure that we are seeing the results we want, super important, especially when you talk about these recurrent ear infections. And that leads me to mistake number 5. Mistake number 5 in managing otitis: not figuring out the underlying cause, or at least trying to figure out the underlying cause, because some of these are really tough. It is really important with otitis we figure out why it is happening. Allergies a lot of times are the culprit, especially in dogs, atopic dermatitis, food allergy, but it's not always the culprit, right? We could recheck that ear, which again, why recheck so important. It helps us figure out the underlying cause. That first exam, that owner may be super overwhelmed. So to talk about a diet, try all these other things, if they're like, I just want comfort for my pet, they may not be ready for that discussion yet. So recheck, even if it's a good recheck, allows me to even ease into that more. Like, here's why we need to figure out what's going on. These ear infections will keep coming back. They could get worse. We could get other changes to the ear that I can't medically reverse. So the recheck allows for that, but we do have to do the workup, whether it is a diet trial, whether it is finding the allergy medication for atopic dermatitis or a good flushing protocol that's going to control that particular pet, whether it is, okay, the recheck, now the ear is more open, I can see down the ear better, whoop, there's a polyp. Right? Oh, there's a foreign body. So the recheck is so crucial, not only to change your protocol if the infection itself isn't responding, but also so you can start to get into those conversations of we need to figure out why this is happening. And when we do videotoscopies, if we recheck, we see that ear still is struggling. I mean, that's part of the reason for videotoscopies is not just to do a deep therapeutic ear flush if we need to get a sample of that, middle ear. It also helps us just to explore the ear and see if we can get a better picture of what's going on. These ear canals are small, so it can be really, really hard to actually get all the way in there and see something like, oh, the tympanum is ruptured. Oh, I thought that was hair, but actually that's a grasson. I've been fooled by that before, where ear was not responding. The way the grasson was positioned, it just kind of looked like hair. When you get in there, you realize it's not. So that's why that can be really helpful. But the recheck, so when one, we can educate. Two, we can see if there's other things going on. Three, that we can really work on figuring out that primary cause is important. And we have to figure out the underlying cause so that we can prevent them from happening as often in the future and to prevent them from progressively getting worse. So top 5 mistakes I think that are made with cases of otitis. And again, I have done all of these at one point or another. 1, not performing cytology so we know what we're actually treating. 2, make sure you're implementing an appropriate flush protocol, whether that is education to the client, selection of ingredients. 3, failing to control inflammation. So let's make sure we know what we're going to do to control inflammation, depending on the severity, whether it's oral steroids, adjusting the topical steroid potency within the product that you're using. But let's make sure we're controlling that inflammation. 4, recheck progress. So mistake being not rechecking progress. Let's actually get them back in. Let's look. Let's make sure things are resolving the way that we hope that they would be. And then the last, make sure that we figure out the reason why these ears are becoming infected so that we can prevent a lot of strife and frustration and discomfort in the future. So again, these things happen. I have done these things, but just think about maybe the next time you're looking at an ear case, some of these little steps that could be missed along the way when we're all really busy, and that you might be able to adjust a little bit of how we're looking at these ear cases and getting better at treating them. There's no shame in it. We all learn as we practice longer. Again, these are things that I myself at one time or another have done, and I will probably do, right? I've been behind on appointments and forgotten to mention the diet trial that we should be doing. So it happens. But by getting the reps in, by getting comfortable with treating otitis longer, it can become a really fun thing and really rewarding when you see these cases come in and they're doing so much better. And truly, otitis, I think, is one of the most uncomfortable things we deal with in dermatology. So if we can provide a better quality of life for the pet, for the owner, that is a huge win.